Hi there, this is John, and this is another video clip tutorial about endocrine disturbances or endocrine abnormalities. So for this clip, I'll be talking about disturbances affecting hormone regulation. Now remember, when you talk about hormone regulation, the mechanism or the system in your hormone release is actually being regulated or under the influence of your endocrine system. Am I right? Now to start with your endocrine, please be reminded of the normal pathway of hormone regulation. Now remember, in any form of hormone release, they follow the same pathway. Now remember, in your endocrine, it is said to be a ductless gland. In short, if it is ductless gland, it means to say that they will release the substance directly into the bloodstream. There's no specific path or a duct where it passes, but directly into the bloodstream. Now, since it is a form of a ductless gland, again, it follows the same pathway. And what is the pathway? Here it is. So remember, in any form of hormone release, they follow the same pathway. So first, we have your hypothalamus. Remember that your hypothalamus regulates the activity of your pituitary gland. Pituitary gland. Now, what is another name of your pituitary gland? Your pituitary gland is also called hypophysis. Do not forget that. Hypophysis. Once stimulated, your pituitary gland now releases a hormone. Remember? Okay? When you say hormone, please be reminded that hormones are specific. When you say specific, when hormones are being released, it goes directly to its target structure or organ. In short, hormone goes to its target cell or target organ. Can you follow? When that hormone reaches the target structure or target organ or target cell, that is the only time it will take an effect or effects. In short, hormones are specific. Pag pupunta yung hormone sa structure or organ na hindi niya target, walang effect. Effect happens only if that hormone reaches its target structure. Let me give you an example. Just an example, okay? This is the mammary gland. This is the nipple, okay? So let's say this is a baby boy, okay? Please bear with my drawing. The baby boy now, okay, needs milk. So what will happen? Okay, syempre, i-offer ng mama niya yung breast niya, alright? Here, baby, here, baby, here. So the baby now will suck. Remember, when the baby now sucks the nipple, okay, when the baby sucks the nipple, it sends impulse to your hypothalamus. Hey, somebody's sucking on the left breast. What will happen now? Your hypothalamus will send an impulse to your pituitary gland. Hey, pituitary gland, do something about it. Okay? So once stimulated, the pituitary gland now will release the hormone. Question: what hormone is being released? Answer: it is your oxytocin. Having said that hormones are specific, your oxytocin as a hormone has a specific target structure. Am I right? So what are target structures of your oxytocin? Your answer: mammary gland and uterus. Therefore, when oxytocin reaches its target structure, again, mammary gland and uterus, that is the only time it will take an effect. So question: what will happen now to your mammary gland in the presence of your oxytocin? Your mammary gland will contract, releasing milk. Can you follow? You call that as your let-down reflex, or you also call that as your milk ejection. Please do not confuse yourself with milk ejection and milk production. Just a reminder, milk ejection is facilitated by oxytocin. Milk production or lactation is facilitated by your prolactin. Can you follow? That's your milk lactation or milk production, prolactin. Okay? Now, what about the effect of oxytocin in the uterus? Of course, uterus now, the uterine wall, the uterine muscle will contract. Can you follow? Why is it important for the uterus to contract? Remember, post-delivery, we always give syntocinon or oxytocin drip. The main reason why we give oxytocin is to prevent postpartum bleeding. Remember, you need to promote uterine contraction. Am I right? See, they follow the pathway, right? So first, hypothalamus, as mentioned, hypothalamus regulates the activity of pituitary gland. Remember, another name of pituitary gland is your hypophysis. Now, once stimulated, your pituitary gland releases a hormone. Once hormones are released, it goes to your bloodstream. Remember, okay, I said that endocrine is a form of a ductless gland. Once a substance is released, it goes directly to the bloodstream. Now, when it enters the bloodstream, it goes to your what? Target cell or structure. When that hormone reaches the target cell or structure, that is the only time it will take an effect. Can you follow? The problem here is actually your pituitary gland. Kasi some of you, hindi alam yung division ng pituitary gland and what are hormones are being produced. So here is. Here it is. Your pituitary gland is divided into two. Anterior and posterior pituitary gland. Remember, another name of anterior pituitary gland is what we call your adenohypophysis. Okay? Another name of your posterior pituitary gland is what we call neurohypophysis. Remember, I said another name of pituitary gland is hypophysis. By the way, what is a surgical procedure? Removal of pituitary gland. Remember, we said removal, it ends with ectomy, right? So removal of pituitary gland is what we call hypophysectomy. Can you follow? Hypophysectomy. Anyway, let's go back. Okay, anterior pituitary gland, you also call this as your adenohypophysis. Posterior pituitary gland, you also call this as your neurohypophysis. I mentioned that pituitary gland produces hormone. Yes, question here. How many hormones produced by the pituitary gland? Well, that depends. Are we talking about anterior or posterior? Well, anterior pituitary gland produces 7 hormones. Posterior pituitary gland produces 2 hormones. All in all, pituitary gland produces 9 hormones. Can you follow? 7 from the anterior or 7 from your adenohypophysis and 2 from your posterior or neurohypophysis. So the question here, what are hormones produced by the anterior and hormones produced by the posterior? Let's identify. Remember, anterior produces 7 hormones. 1, 2, 3, 4, 5, 6, 7. Posterior, 2 hormones. Let's identify. What are hormones produced by the anterior pituitary gland? Well, you have your GH. GH stands for growth hormone. What else? MSH. What does MSH stand for? Melanocyte stimulating hormone. What else? You also have your prolactin. Remember, I mentioned this a while ago, and this hormone has something to do with milk production. Another term for milk production is lactation, right? Another hormones produced by your anterior pituitary gland are the following: FSH, LH. What does FSH stand for? Follicle stimulating hormone. LH, luteinizing hormone. What else? You have your TSH. What is TSH? Thyroid stimulating hormone. And last will be your ACTH. What does ACTH stand for? Adrenocorticotropic hormone. So these are hormones produced by the anterior pituitary gland. Remember, there are 7. 1, 2, 3, 4, 5, 6, 7. Okay? For the posterior pituitary gland or your neurohypophysis, it produces 2 hormones. And what are this? First, you have your ADH. Remember ADH? Okay? Or your antidiuretic hormone. You also call this as your vasopressin. Can you follow? And the last hormone produced by the posterior pituitary gland is what we call your oxytocin. Now, for your medical surgical nursing, I want you to familiarize the 3 hormones. And what are this? Familiarize TSH, ACTH, and ADH. These are hormones, okay, that will be discussed under medical surgical nursing. Why? The rest of the hormones, these hormones were actually discussed under maternity nursing and pediatric nursing. Therefore, my focus in medical surgical nursing are these 3 hormones. Pag natapos natin yung 3 hormones, I will discuss other endocrine structures and we will end with your diabetes mellitus. Can you follow? So pag hindi pa ako na-discuss ng diabetes mellitus, hindi pa tayo tapos sa endocrine. So what I'm going to do here, okay, because the entire concept can be read in the textbook, The Chronicle of Medical Surgical Nursing. So this is just a supplementary video. So ang gagawin ko is that I will identify the hormones and give you a bird's eye view with regards to hypersecretion and hyposecretion. Remember, there are only 2 disturbances in your endocrine. It can be a form of hypersecretion. It means to say there's excessive production, or the other disturbance is what we call hyposecretion, or there's what we call deficiency. So having said that deficiency is hypo and excessive is hyper, the management here will be simple. And what is the management? Too much of something, well, get rid of it. Or if there's hypersecretion, you give anti. Am I right? If you have hyposecretion, the management will be, of course, supplementary. It means to say you have to give the missing hormone. Can you follow? In your examination, be particular with the diet of the patient as well as the signs and symptoms of the patient. Remember, you don't have to memorize everything. Can you follow? Don't make it hard for yourself. Ibig sabihin, you have to familiarize one disorder. If you love to familiarize hypersecretion, then familiarize all hypersecretions. Yung hyposecretion, baliktarin mo na lang. Ibig sabihin, if in your hypersecretion, you have tachycardia or increased heart rate, common sense will tell you in hyposecretion, there will be bradycardia or a decrease in the heart rate. This is why you don't have to memorize everything. Can you follow? You just have to understand the physiology and its effect. Can you follow? So that you will have an idea what will be the manifestations of the patient of the opposing disorder or opposing condition. Anyway, let's continue. So I'll be giving you a bird's eye view of the different hyper and hyposecretions. Sorry. So let's start with what we call hormones under anterior pituitary gland. Remember, there are two divisions of your pituitary, the anterior and the posterior pituitary gland. And I mentioned the anterior pituitary gland produces 7 hormones, right? So number 1 is what we call your growth hormone. Can you follow? Growth hormone, okay, growth hormone from the word itself, growth. Sorry, it means to say it is a hormone that promotes longitudinal bone growth. Sorry, katatapos ko lang kasing kumain. Anyway, let's go back. So the disturbances here are the following. You have your hypersecretion of growth hormone and hyposecretion of growth hormone. Remember, if hypersecretion of growth hormone happens sa adult, it's a different thing. If hypersecretion of growth hormone happens sa mga bata, it is also a different thing. Right? So what do you call that disorder? Okay, hypersecretion of growth hormone to adults. You call the condition as what we call acromegaly. Am I right? But if hypersecretion happens to pediatric, you call that condition as your gigantism or other book, gigantism. Now highlight in your examination. One effect of growth hormone is that growth hormone causes hyperglycemia. So do not forget this. A patient with acromegaly, a patient with gigantism or gigantism, they also manifest hyperglycemia. Please don't forget that. Now, what about growth hormone hyposecretion? Hyposecretion of growth hormone, you call the condition as what we call dwarfism. Question, when can we say that a person is dwarf? Of course, it has something to do with the height, right? So, a person who is said to be dwarf or having dwarfism is a person with a height of less than 4 feet. Can you follow? So beyond that, you're not labeled as dwarf. Can you follow? But anyway, that's your growth hormone. Another hormone is what we call your MSH or melanocyte stimulating hormone. Now take note. Hypersecretion of MSH and hyposecretion of your MSH. Hypersecretion of MSH will result to what? Increased melanocyte production. Remember? Or not melanocyte, but melanin. Ayan na naman, yung best friend nating tuko. Best friend ko yan every night. Tapos na. Siguro magre-review din siya. Anyway, balikan natin. Your melanocyte stimulating hormone, there's hypersecretion. Remember, it is a hormone that will stimulate the melanocyte. So what is the effect? The effect here is that your melanocytes are stimulated, excessively stimulated, to produce a pigment called melanin. Remember, melanin is a pigment that causes what? Skin discoloration. That is why there's an excessive or increased MSH that results to skin pigmentation, or shall I say darkening of the skin, or shall I say tanning of the skin. Can you follow? Now, but for patient with hyposecretion of your MSH, this will result to a condition called albino or albinism. Or, dito sa Pilipinas, ang tawag natin dyan, anak araw. Am I right? So, this is now the second hormone. Another hormone, okay, produced by your anterior pituitary gland is your prolactin. Am I right? So, what will happen now if there will be imbalances? Well, hypersecretion and hyposecretion. Excessive production of your prolactin will result to positive for lactation or milk production. But for patient with hyposecretion, of course, negative for lactation. Can you follow? Now, what about other hormones? Here, FSH and LH. Now, what will happen now if you have FSH and LH disturbances? Well, sa mga babae, of course, it may lead to menstrual disorders. Anyway, I will mention and I will discuss menstrual cycle after this video clip. So you better watch the video about menstrual cycle because I'll be giving technique how to easily memorize hormonal changes and imbalances or levels of hormones during menstrual cycle. Okay? Now another hormone is what we call your TSH. TSH or thyroid stimulating hormone. Now take note. Since continuing space sa baba, let me clean the board, okay, and discuss TSH. Another is your TSH. Okay, now look. Thyroid stimulating hormone, it means to say it is a hormone that stimulates the thyroid, right? Once the thyroid is stimulated, it produces its own hormone. Can you follow? I hope you can still remember the different hormones produced by the thyroid gland. You have your T3, T4, and then you have your thyrocalcitonin or your calcitonin. Alright? Anyway, now look at your disturbances. Hypersecretion of TSH or hypersecretion of thyroid stimulating hormone, you call that condition as your thyroidism. Am I right? Please be reminded that another name of hyperthyroidism is what we call thyrotoxicosis. Can you follow? An example of your hyperthyroidism is what we call Graves' disease. This is a common mistake of student nurses. Usually, pag tinatanong ko sila, what is another name of hyperthyroidism, they will answer Graves' disease. Mali po. Graves' disease is an example of hyperthyroidism. This is the analogy. It's just like saying, parang ganito, antibiotic. Another name of antibiotic is anti-infective. Example of antibiotic will be your penicillin drug. Am I right? Therefore, if an example of antibiotic is penicillin, we cannot say that another name of antibiotic is penicillin. Kasi maraming klaseng antibiotic. Am I right? May penicillin, may tetracycline, may aminoglycoside, may quinolones. Am I right? Same thing here. Maraming klaseng hyperthyroidism. May Graves' disease, may Pott's disease. Can you follow? Pero ang pinakasikat na hyperthyroidism, example, is Graves' disease. Pinakasikat at common na antibiotic is your penicillin drug. Can you follow? I hope naintindihan yon. Hyposecretion of T3K of your TSH will result to decreased T3, T4. Am I right? So you call the condition as your hypothyroidism. Now reminder, if hypothyroidism happens sa mga bata, there's a specific term for that. If hypothyroidism happens sa adult, there's also a specific term for that. Now, what do you call that condition? Hypothyroidism for pediatric. You call that as your cretinism. Hypothyroidism for adult, you call that as your myxedema. Can you follow? I hope so. Next, another is your ACTH. Can you follow? Your adrenocorticotropic hormone. Now, reminder, your ACTH, the target of your ACTH is actually your adrenal cortex. Can you follow? Your adrenal cortex is actually part of your adrenal gland. Now, your adrenal gland can be found on top of each kidney. In short, if this is the kidney, on top of the kidney there is a gland. You call that gland as your adrenal gland. Since adrenal gland can be found on top of the kidney, another name of adrenal gland is your suprarenal gland. Supra, above, renal, kidney, above the kidney. Now, if this is your adrenal gland, okay, your adrenal gland is divided into two parts. The outer part is what we call your adrenal cortex. Can you follow? And the inner part is what we call your adrenal medulla or adrenal medulla. The target of your ACTH is actually your adrenal cortex. Can you follow? Now, adrenal cortex produces hormones. Can you follow? You have your cortisol, you have your aldosterone, and you have your adrenal androgen. Now, whereas your adrenal medulla, it produces catecholamines. Remember, epinephrine and norepinephrine. Okay? So, in your adrenal medulla, it produces catecholamines or catecholamines. Whereas your adrenal cortex, it produces adrenal hormones. Can you follow? So, here comes now your disturbances. Hypersecretion and hyposecretion. What do you call that condition wherein there is hypersecretion of adrenal hormones? Ang tawag doon, you call that as your Cushing or Cushing's syndrome. Whereas hyposecretion of adrenal hormones, ang tawag doon ay Addison's disease. Now, what about catecholamines? Normally decrease. Am I right? But if there is an increase of your catecholamines or catecholamines, you call that disorder as your pheochromocytoma. Pheochromocytoma. So somehow you will have an idea. Am I right? So kung mataas ang catecholamines, mataas ang epinephrine, increase ang vital signs, a patient is hypertensive. That is why a patient with pheochromocytoma, remember, watch out for hypertension. Since the patient is hypertensive, you need to have a daily diary or documentation. You cannot palpate deeply, okay? Deep palpation the abdomen of the patient. Can you follow? You can even do deep palpation of the kidney because, of course, the risk of what we call hypertensive crisis. Okay? So these are hormones produced by the anterior pituitary gland. Remember, there are 7 hormones. Growth hormone, melanocyte-stimulating hormone, prolactin, follicle-stimulating hormone, luteinizing hormone, thyroid-stimulating hormone, and your adrenocorticotropic hormone. So these are 7 hormones produced by the anterior pituitary gland. For your posterior pituitary gland, as mentioned, their PPG or your neurohypophysis will only produce 2 hormones, right? So what are the 2 hormones produced by your posterior pituitary gland or referred as your neurohypophysis? Your PPG. Well, first is your ADH. Remember ADH or antidiuretic hormone, or you call this as your vasopressin. Look at your disturbances. Hypersecretion of ADH and hyposecretion of your ADH. Too much antidiuretic hormone, you call that condition as your SIAD, or syndrome of inappropriate antidiuretic hormone. Hyposecretion of your ADH or vasopressin is referred as your diabetes insipidus. Can you follow? Let me remind you that SIAD, diabetes insipidus, or in short, ADH imbalances, it has an unknown cause. It is idiopathic. But patients who had surgery, had injury, are at risk for ADH imbalances. Kaya nga, if lalabas sa examination, papipiliin kayo sino ang mga pasyente doon at risk for SIAD, at risk for diabetes insipidus. Hanapin nyo sa option ang pasyente who had surgery or had injury. Can you follow? That is the correct answer. Next, another hormone produced by your PPG, of course, is your oxytocin, or your syntocinon, remember? Now look at your hyper and hyposecretion. Hyper and hypo. Excessive, of course, this will result to contraction. Am I right? Remember, I said the uterus will contract. And, as mentioned a while ago with regards to your milk, it promotes what? Milk production or milk ejection? Answer, milk ejection. So this will facilitate milk ejection. What is another term for your milk ejection? You call this as your let down reflex. Am I right? What about hyposecretion of your oxytocin? Of course, that will result to muscle atony. Can you follow? And of course, that can result to uterine bleeding postpartum. So these are the different hormones produced by your anterior and produced by your posterior pituitary gland. A thorough discussion of this will be discussed or can be seen in the Chronicle of Medical Surgical Nursing. I hope this video clip will supplement and will help you understand better the Chronicle of Medical Surgical Nursing review notes. Thank you so much, and God bless everybody. Bye!